Hello, how are you doing? My name is Susie Beers. I am the doula with She Births Bravely. And today we are going to talk about the pros and cons of epidurals so that you can make an informed and educated decision about if this tool is the right one for you to help you cope with pain during labor. Now, this class has been taken right out of my birth course that you can find at learn.shebirthsbravely.com. So if you are watching this video and you think, wow, I really need to learn a little bit more about preparing for labor, make sure to join the course so we can get you really, really confident in everything that you need to have in place to get through labor and to have a great experience and a beautiful beginning. Enjoy this video and like and subscribe for more great content about how you can create a great beginning in your birth. Enjoy the video. Hi, you guys. I am so excited that you are here today to talk about the epidural. If there is one decision that is probably the most important decision you're making about your labor process, it's if you're going to use an epidural or not. Epidurals have a lot of really good to them. A lot of people call them the gold standard of pain relief during labor. On the other hand, other people are very worried about a cascade of intervention and an epidural leading to problems down the road in your labor. So today we are going to talk about the pros and cons of an epidural, what's good about them, what's bad about them, and strategies for mitigating those risks. I had this amazing mom that I worked with about a year ago, and we had planned her birth to be a natural birth without an epidural. And she called me about a day before her due date. Actually, it was the day before she went into labor. And she said, you know what, Susie, I've been thinking about it a lot, and I really just want to use the epidural. And I said, okay, that's great. Tell me more about that. And she said, I've just been thinking that the main reason I didn't want an epidural was because I felt like I would be a better mom if I didn't use it. But I want to be present and I want to be not in too much pain so I can really bond with my baby. And I think that that's what will help me bond. She used an epidural. She had a great birth experience. And you guys, it was just an incredible birth. On the other hand, I have worked with many, many moms who have used the other pain coping tools and strategies in this class to really create a beautiful beginning and manage labor without an epidural. So there is no one right choice. What I hope you get from this class is the knowledge that you can make an educated, evidence-based, informed decision that is right for you, knowing that with millions of moms giving birth every year, there is not ever going to be one right answer for all of us, which gives you permission to make the choice that is right for you. All right, so what is an epidural? An epidural is a way to deliver pain relief, medicine, and anesthetic that stops pain signals from traveling from the spine to the brain. You can see the anesthesiologist here is just placing a catheter into the mom's back, and that just stays in your back throughout labor and offers a continual drip of that medication straight into your spine. Do epidurals work? Well, how effective are they? A lot of people do call the epidural the gold standard of pain relief. And it is true that 9 out of 10 women will get adequate relief and will not need any additional support with pain in their labor after getting an epidural. On average, when we look at the pain scale, moms say that epidurals lower their pain about 3.5 points on a scale of 1 to 10. It's not a perfect drug. It's not a perfect solution, but it is a good option for some people. So what happens when your epidural works perfectly? Well, you will be numb from your breast line through your pelvis and your legs. Most people do not have great control. Like, you can't really walk after getting an epidural. some women can move their legs a little bit and some women cannot. Even if your epidural is working perfectly, you will not feel the pain of contractions, but you will feel the pressure of your baby moving down in your pelvis. Now, I have had moms that have gotten an epidural and they feel none of that. And other moms that say that the pain of that pressure of baby coming down is just as intense near the end of labor as it was before they got the epidural. But usually, even when people say that, they say, I am so glad I got a break for however many hours from when they decided they needed it to that point where they're very late in labor, approaching pushing, and they're feeling that pressure. Ideally, you will feel a little bit of pressure so that you know when to push. You can tell when a contraction is starting and when it is stopping, and you will have a bit of that urge. However, epidurals don't always work perfectly. That's no surprise. Nothing in life is perfect every time. Sometimes with an epidural, you may not feel relief on both sides of your body evenly. You might, say, get complete relief on the right and no relief on your left. You can also have like a window at some spot on your back where you are having just as much intense pain as you were before, but now it's just confined to that one spot. And third, you may not feel enough of your contractions to know when to push and might need quite a bit of coaching through the pushing process to know when to push, how hard to push, when to breathe, when to stop, all of that stuff. If your epidural is doing one of these weird things where you have a spot or a window, you can insist that the anesthesiologist come back. Often they can either, one, adjust the dose, meaning that they can give you more medication through that spot, through the catheter. Two, because the catheter is just this little teeny tiny tube that is staying in your spine, if it's tilted a little bit, it might be giving all of the medication to one side of your body versus the other. And they can usually fix that. So make sure that if your epidural is not working well, that you ask for them to come back and fix it, even if you have to ask multiple times. Now, one thing that I have noticed is that moms that I work with who have had surgeries or injuries to their pelvis or their back often have a lot of pain that the epidural can't touch. It can be helpful to still have an epidural for some of these moms because you're having the injury pain as well as the labor pain. But other times it can be unhelpful because you're wanting relief and you cannot get to a place where you get the relief you want. Just be aware that if you've had an injury, that you're going to need to come up with ways to cope with that pain, even with an epidural. Or you may need to be prepared to cope with that, even with an epidural. There are a lot of really good reasons to want an epidural. Like the mom I mentioned in the beginning, there are legitimate reasons. One is that it is 100% okay to say, I want to be comfortable through this process. I don't want to experience all of labor. I'd like to sleep and rest through some of it. Second is that one of the great things with an epidural is that you can relax and wait. So if you are trying to cope with contractions and nothing is really helping you get through it, an epidural can be a really great tool. Sometimes if we are so tense that we cannot handle contractions, when we get an epidural, the body can release and you can dilate and open. That is something that happens for some people when they get an epidural. The third reason is that labor can feel out of control for some of us. And if the feeling of contractions or the feeling of not being in control of the labor process is avoiding, is kind of triggering past abuse and trauma. An epidural can sometimes help avoid that. And other moms need to go through the pain or need to go through the contractions in order to feel safe and protected from their past abuse and trauma. So it is 100% okay to talk with a therapist, to talk with your doctor, to talk with your midwife about, and your doula about your trauma, your past history, because you may find that it triggers responses in you during the labor process. It's normal. Most of us have training around how to support people when that comes up. Fourth is mental comfort. Again, if you're mentally not in the game of labor, it's okay to want to be out of that pain, right? That mind-body connection is really powerful. You can absolutely, if you can bring in more joy, more presence, and more, think about the oxytocin drug we talked about before, that hormone naturally made by your body. If you can feel more connected and bonded and supported with an epidural, then it's okay to use. What you want matters a lot. There is not one right answer here. There are even times when an epidural might be medically needed. If you are having a really prolonged labor, say your labor is lasting 2 or 3 days, then it might be the right thing to get an epidural. I see more moms switch from a plan of a natural birth to a plan of an epidural birth because of exhaustion than because of pain in itself. Second is an induction. The pain level is just not the same when the level of the hormones more often gets out of control, or your natural endorphins and oxytocin is not always keeping up with the intensity of the work. When you're going through an induction, you're more likely to have periods where you're having gaps and you feel more pain. I have had a couple moms get through inductions without an epidural, but I've also, on the other hand, seen moms push themselves so far and through so much pain only to be at 2 or 3 centimeters. So it can be a medically necessary thing to have an epidural during an induction. So keep your mind open and pay attention to your needs in that process, and be willing to use the tools around you if you do go forwards with an induction. Getting an epidural, what are the steps to getting an epidural? It's pretty simple. You have to be admitted to the hospital. Typically, this means you have to have a strong enough contraction pattern that you're in the active labor part of labor, where your contractions are coming every 4 to 5 minutes, and they've been that way for an hour, and they're lasting a minute apiece, and their intensity level is up here. You'll also have to be able to receive fluids, which is going to take about half an hour. You have to get that local anesthetic. What they do is they just take a shot and they numb everything in your back. Then they put a needle into your back to put that really teeny, super fine catheter into your back. The needle will come out so you don't have anything sharp in your back. And then you will receive medicine through that catheter until after you deliver your baby and the placenta and have any tears repaired. So one of the great things about an epidural is that it really does last throughout all of labor. And it is one of the very, very few ways to get ongoing. It is the only way to get that ongoing medical pain relief throughout labor. Unfortunately, there are rare cases where an epidural really is not an option. If you have certain bleeding disorders, clotting issues, or some other blood-related disorders, an epidural may not be appropriate. Same as if you have certain brain conditions, spinal issues, spinal cord injuries, and really severe cases of scoliosis, an epidural may not be a good option or may not give you the same amount of relief as you were expecting. About 1 in 10,000 people will have an allergy to some of the medication used in the epidural. Super rare, but it is possible. If your baby is crowning, so you are so far through labor that you're 9, 10 centimeters and pushing, and your baby is really, really low, it might be too late. Other than that, there's really not a time that is too late. You have to have that half an hour to be able to get the fluids and have enough time for the anesthesiologist to do all of his stuff with placing everything. Just going to take about half an hour to 45 minutes total. So if you have more than that left in labor, you can get the epidural. You can't get an epidural if it's just too early in labor. You have to be admitted and the anesthesiologist has to be available. So even if you are planning to get an epidural, make sure that you are planning also for how you're going to cope with labor until you can get that epidural. Now, the risks, the cons, and I really wish that these did not exist and I could tell you that they were so rare, they're basically non-existent. And you will see that these are extraordinarily rare. Epidurals are typically considered very, very safe, but there are some potential complications. About 4 out of 1,000 people will get a spinal headache. This won't go away usually with Tylenol, but usually you can ask for support, tell your nurse and the anesthesiologist about it, and they can usually do something about it. 1 in 3,000 people can have cardiac arrest, and another 1 in 3,000 people can have respiratory distress. This is why we do epidurals only at the hospital, where you have a team of people that are there that can help mitigate any of these severe complications. These are so rare, you guys, but they do exist. What about long-term problems? Again, we're looking at extraordinarily rare, but still exist as far as cons of the epidural. Some moms can have a headache or chronic backache from an epidural. Those happen respectively 6 out of 1,000 and 5 out of 1,000. So it's rare. But if it does happen, it can last up to 18 months after giving birth and could potentially be permanent. Unfortunately, there's not really a way to predict who this is going to be, even though it is rare. Epidurals also have some really, really short-term side effects as well. These are much more common, but again, they can be mitigated pretty easily through your care team is going to be prepared to handle these. When you get an epidural, you can have a drop in blood pressure. This can be really good, actually, if you have high blood pressure. In about 14% of women, you can have shivering, ringing in ears, dizziness, nausea, and vomiting that happens with that drop in blood pressure. You can also have a fever that is caused by the epidural. You can also have a fever just because you're in labor for a long time. The number of women with a fever in labor increased 7% for labors that were fairly short, for people who had an epidural less than 6 hours, and 36% for people who were in labor, for 36% for people who had an epidural for more than 18 hours. So there is some benefit to trying to time your epidural so you're not getting it really early in labor where you might be having it for an extended period of time. One common complaint I hear from moms is just body pain. Once you get an epidural, you are in bed, and unless you have a really great nurse or very supportive partner or a great doula that is helping you change positions every 15 to 30 minutes, you can get really sore in certain spots of your body. But also, labor is very hard work, so it's normal for everybody to feel very sore after labor. Another side effect is hunger and weakness. Once you get an epidural, you are usually on clear liquids only after the epidural is placed. Again, you have the IV fluids, so your body's getting a little bit of support there. You're not going to get dehydrated. But if you've had an epidural for 18 hours and then you are going into pushing, fasting, it can be really hard to push yourself when you have no energy and no fuel. Again, sometimes that is less bad than the pain of labor, and sometimes it is more bad than the pain of labor. It really comes down to how we as individuals cope with these different challenges. Now, the question everybody wants to know, are there any risks to baby with an epidural? While there are not necessarily direct risks to baby that we, in the short term, that we know of immediately, that increased risk of fever, though, is important to babies. When a mom has a fever during labor, babies are more likely to have hypotonia. They're more, it's kind of when their bodies are like weak and limp. There's more need for assisted ventilation once they're born. They're more likely to have lower 1 and 5 minute APGAR scores and have seizures. Typically, it's still not super common to see these, but it is possible. So again, risk-wise, risk is not destiny. It does not mean because you had an epidural, you are going to have a fever and then your baby is going to need support. But there will be people that follow that path. Also, an epidural is associated with longer pushing because we talked about how you might not feel the power of your contraction when you're pushing. You might not feel that pressure down. Longer pushing is associated with higher rates of a low APGAR score, NICU admissions, birth trauma, and other problems for a baby. In one study, researchers found that the overall rate of complications for babies is around 2.5% for first-time mothers who push 3 or more hours. 3 hours is not an exceptional amount of pushing. For a first-time mom, 3 to 4 hours is with an epidural is kind of normal. It's very normal. Some people will push more. Make sure to go back to our class about strategies for pushing with an epidural so you can get the evidence on how to kind of get through that part without adding extra risk. Or, we can't take away all the risk, but we can try to mitigate it, right? And then this is the part that I really hate talking about, but there has been a little bit of research about how an epidural could affect a baby's brain, and there has been some mixed research here. So we're going to talk about it. If you have questions, I'm happy to send you the studies so you can kind of dive into it further. There has been research recently, 3 really large studies that talk about the rates of autism when moms used an epidural versus when moms didn't use an epidural. The research started in 2020 when Kaiser did a study looking only at moms who, they were comparing moms who had an epidural versus moms that didn't, and how many of those kids were diagnosed with autism spectrum disorder. And they found that when moms used an epidural, they had a 1.9% chance of autism versus a 1.3% chance, which in one sense seems like a tiny adjustment. On the other hand, it is a 30% relative increase in risk. And they looked to see, could this be caused by the fever? And they ruled that out. In this study, 74% of moms had epidurals, which, depending on the study, we know that about 60 to 70-ish% of moms are using epidurals. We also know that in every single one of these studies, there are certain kids that will have a diagnosis that were not found in the study. About 1 in 44 children has been diagnosed with ASD. So you can see that, 1.3 to 1.9, we're still missing some diagnoses. So it's hard to say how, at its worst, how influential could an epidural be as a contributing factor to a potential diagnosis later in life. Other researchers since the Kaiser study in 2020 have looked at the risk of autism in moms who used an epidural versus moms who didn't use an epidural as well. There was a Stanford study, and they found in their crude data that they found very similar to Kaiser, where when moms used an epidural, there was 2.1% of babies had diagnoses versus the 1.7% had diagnoses in the families that didn't use an epidural. However, once they started looking at other factors, they determined that it was not the epidural that ultimately was causing this increase. They looked at all kinds of things that have been thought to potentially influence autism risk. They included socioeconomic factors such as the mother's education, marital status, neighborhood, socioeconomic level, medical history, diabetes, hypertension, anxiety, depression, medical conditions during pregnancy, smoking, alcohol, hospitalization for mental illness, the mother's use of several different types of prescription medications, medical complications during delivery, and other factors related to the mother's pregnancy and labor. And they said, we don't think that it was the epidural that was causing the increase in diagnoses. It was probably something else. Unfortunately, they did not clarify which out of all of those factors contributed to the diagnosis. So there is a lot to be learned still. Just recently, 2023, the American Journal of Obstetrics and Gynecology did a similar study where they were looking at the autism rates with moms that used an epidural versus moms that didn't use an epidural. And again, in their crude data, when that was the only factor that they looked at, they did find that there was a slightly higher rate of diagnoses in moms that used an epidural versus moms that didn't. However, they similarly said, we don't think it was the epidural. They looked at families where they had mothers and sibling pairs where one sibling had an epidural and the other didn't, or a mom had two children, one with a diagnosis and the other, and she had an epidural for both births, and said, we do not think that this is the contributing factor. These two second studies, though, they only had they didn't capture all the moms who were using epidurals. They had, I don't necessarily know how much of a factor that is, but I am curious always to know why were people excluded from the study? Unfortunately, there is unclear data and no real answers, but again, it is important to remember that risk is not destiny and that these numbers are quite low to begin with. So we will all have our own personal risk tolerance. I know there are some people that will see these numbers and say, I am not having an epidural. I'm absolutely not doing it. And other people that will say, those numbers are pretty similar from group A and group B used an epidural and didn't, so I feel okay using it. That is a personal decision, and you are 100% allowed to use your own risk tolerance when making the decision for an epidural or not. All right, let's go ahead and move on from this. Another thing that we need to think about with epidurals is, what about breastfeeding and epidurals? There is conflicting information about how epidurals affect breastfeeding because we have two factors that can affect breastfeeding. Pain that is uncontrolled and excessive definitely interferes with breastfeeding success. Moms who experience trauma and who are pushed beyond their limits from pain have a hard time establishing breastfeeding. On the other hand, the epidurals can have some short-term effects that can make getting breastfeeding established a bit more difficult. One is that babies can be more sleepy and they can have a hard time waking up to eat after having an epidural. Typically, you talk to your baby, you give them plenty of time, and most babies with an epidural will latch just fine. Sometimes your breast tissue may be more swollen because you've had a lot of fluids in your body, which make you just a little bit boofier. And sometimes it makes it a bit more difficult for babies to latch, meaning that we need to have a little bit more time and patience as we are helping these babies and exploring the beginning of the breastfeeding journey. I think the most significant impact that epidurals have on breastfeeding is that you might be a little bit more puffy because you have all the fluids that have been pumped into your body, but so are babies. And it is really normal. Almost every baby loses weight the first few days of life, and it's normal for babies to lose up to 10% of their body weight. However, a baby that has excess fluids is going to shed that extra fluid, which may make it seem like they are losing more weight than is okay, when really they lost all the fluid plus the normal amount. So what happens is that right here, the first few days of your breastfeeding journey, your baby loses weight, and the initial response is we need to supplement with formula to keep your baby healthy. And it can be hard to know, is this a normal amount or is this not a normal amount of weight loss? But supplementing with formula does make moms who supplement with formula are less likely to be continuing their breastfeeding journey 6 weeks after they begin. So it is something to pay attention to and have really high quality conversations with your care provider about if your baby is losing weight. What can you do about it? Well, if you did choose to use an epidural and you are wanting to breastfeed, then make sure that you have lots of lactation support. While you are at the hospital, there are so many people that can help you feed your baby. Every single nurse is going to have different tips and tricks. They will have lactation consultants there. So ask for help, advocate for yourself. I always say ask every single nurse to help you with every feeding in the beginning, because everybody is going to give you a different tip or trick, and somebody will say that magical thing that just kind of sticks in your brain and makes sense. Second is skin to skin is so powerful. It's important for baby that first hour after birth, but it continues to be important and offer benefits. If you have questions about these benefits, go back to the breastfeeding section where we talk about why this is so important, but continue to do skin to skin over time with your baby. Have lots of undisturbed time where you are just snuggling skin to skin. Have patience, let your baby explore and play, practice opening and closing their mouth and practice that suckling motion. They don't get to read a book to figure out how to do this. They just kind of have to play and explore and try. And just like walking takes a baby a while to learn, of course, a baby has to learn to eat pretty quickly, but if they are getting a few drops, that's enough, right? Fourth, make sure that you have a lactation consultant visit you when you get home. If you can, have somebody come to your house instead of you going to them so they can help you get comfortable where you are. Fifth, keep baby with you in the hospital. This is very closely tied with number 6, which is avoiding formula and pacifiers at the beginning of your breastfeeding journey so that baby can focus on learning the eating motion and the suckling motion from your breast. If baby's not rooming in with you, if they are going to a nursery, they're more likely to be given these alternatives. So if possible, it is very standard in a lot of hospitals now where baby rooms in with you because it does help your breastfeeding journey start off well. Now, even if you have a rough start to breastfeeding, know that there's always a learning curve. There's a lot of support out there, and you can absolutely have an epidural and still have a great breastfeeding experience. All right, so more challenges with an epidural. Can epidurals slow down labor? Well, once you get an epidural, you're going to be laying on your back more often. You will have less use of gravity to keep labor progressing. And you're also going to have, in the first lesson, we talked about this incredible hormone loop that keeps your labor progressing. Epidurals can sometimes interact with that and slow things down, especially if it's taken early in labor. And you may be pushing up to 2 hours longer than without an epidural. There are ways to, again, deal with these complications. One is that they can just use Pitocin, a medicine that will increase your contractions and keep them close together. 2 is that you can change positions and choose positions where you are upright, and that keeps your pelvis nice and open and helps baby rotate. All of those suggestions for positions are in week 5. So if you need to know what they are, hop back there and go get them. And the 3rd is that if you're going to be pushing with an epidural, take some time to practice pushing when you're going to the bathroom so you know how to use your muscles, even if you have a spinal block in place and you can't really feel those muscles. I think in my experience, moms who have practiced pushing can typically push quite well with an epidural when used in combination with the other strategies for pushing that we talked about earlier in the class. At the end of the day, women who have an epidural are 2.5 times more likely to have a surgical birth. I absolutely think that this can be a reason to avoid an epidural and to not choose one, and something to not fear at the same time. Surgical births can still be incredible beginnings for a family, and you should not suffer during labor. So again, you have so many tools in this class. If you want to go without an epidural, you can. And if you want to choose an epidural, do so without fear, and do so without fear of a surgical birth as well. Are there other medical pain relief options if you do not want to have an epidural? Yes and no. There is nothing, none of these are going to give you the continued pain relief that an epidural gives you. Some people like to use nitrous oxide. It is available at some hospitals and birthing centers, and some midwives can bring it to you for a home birth, but it is not a choice at every hospital, so you're going to have to ask and find out. Nitrous oxide can reduce our awareness of pain and help us relax. It's also out of your system extraordinarily fast. Studies have shown that it does not interfere with breastfeeding. It does not inhibit the release of oxytocin. That oxytocin, again, is the hormone that is most responsible for moving labor forwards and for your bonding with your baby. So this can be a good option if you just need a little help while choosing more unmedicated strategies for managing pain during labor. If you're having one of those prolonged labors and you're just exhausted and you haven't been able to sleep for 1 or 2 nights, there is a thing called therapeutic rest. It's morphine. It's also called morphine sleep, where they just give you a little cocktail of medications that numb the pain, slow labor, and give you a break so you can go home and sleep. Most people that take this option will go home and sleep for 6 to 8 hours. and then they will be back in labor. Sometimes it can slow labor and also stop labor. So again, pros and cons with everything. It's a good one to talk about with your care provider if you're in the situation where you really need sleep and you're choosing between epidural or just complete suffering, right? It can be a good option. It's not right for everybody. You can also take opioids. Most hospitals will give you fentanyl during labor, a couple doses of fentanyl. The problem with this is that it gives very temporary relief. It can also cross the placenta and affect the baby, which is okay for baby if you're early enough that you're not going to deliver the baby while it's still in your body. So you have to be at least 30 minutes to an hour away from delivery. Also, it's only going to give you about 30 minutes to an hour of relief. So if you just need a break, but you have it in you to keep going, it could be an option for some people. It can also be an option if you didn't want an epidural or you couldn't get an anesthesiologist soon enough, or you can't get, or the anesthesiologist is, say, in the OR and they won't be available for an hour. This can be a great stopgap until you get an epidural. Whichever type of birth you choose, really think about what is right for you and lean into it. It is a good decision to use an epidural. It is a good decision to not use an epidural. You can have a beautiful beginning either way. You will find in this course lots of strategies and tools to help you with either goal. If you have any other questions, as always, do not hesitate to reach out. I am so happy to help, and I really wish you the very, very best on your birth journey. So we will see you in the next video, and we'll talk again soon. Bye.